This is the Celebrity Wellness Evaluation. I am one of the students, Tabitha Agneer, and here is my PowerPoint. Our patient today is Dwayne "The Rock" Johnson, a 45-year-old Canadian Black Nova Scotian Irish Samoan male. Current vital signs is 102/72 right arm sitting for blood pressure. Temperature is 98.7 Fahrenheit oral. His oxygen saturation is 99% SpO2. Heart rate is 99. He is 6'5 feet, 254 pounds, BMI 30.1, and he currently has no pain. DJ is a 45-year-old Canadian Black Nova Scotian Irish Samoan male. He is a well-known football player, wrestler, and actor born in Hayward, California. His primary provider resides in Hollywood, California. Due to his circumstances, he is unable to see them at this time. He presents to the Las Vegas clinic with the complaint of watery diarrhea, nausea, vomiting, and feeling warm since last night. There is no radiation of any sensation, but he passed a lot of gas when he had diarrhea episodes without belching. He states that he ate a taco from a fish taco food truck while he was out with friends last night at about 6 p.m. At about 9 p.m., or 3 hours after eating, he felt nauseated and threw up 3 times. He states that his vomiting composed of the food he ate, with shell pieces and bits of fish with vegetables. He also had a 2-time episode of runny pale brown watery diarrhea at about 1 in the morning. He had another episode of vomiting at about 3 in the morning. He took his temperature later that night and recalled it being 99.2 something. DJ stated he tried to stop himself from throwing up by eating crackers and ginger ale, but it seemed to make it worse as he threw them up as well. He also tried Tums, but it did not seem to do anything. He denies pain, soreness, or burning at this time or during those episodes, but states that I just feel weak, not sore, no pain, nothing. He states that throwing up like this and being weak may affect my job. I think this is very severe. DJ rates the severity of his current condition as 8 out of 10 on a scale of 0 to 10 at its worst during vomiting and diarrhea episodes, and 6 out of 10 when they subside during sleep, with 0 being no severity or no effect and 10 being most severe. He stated his friend was also acutely ill with vomiting and diarrhea about the same time he was. DJ called this morning at about 8 o'clock in the morning and asked to be seen promptly, where he is now being seen at about 10 o'clock. His past medical history is depression diagnosed in 2002. His surgical history includes an abductor abdomen muscle repair due to trauma and injury from one of his wrestling matches in 2013, and an appendectomy for appendicitis in 2006. For his medication and supplements, he takes Lexapro, an antidepressant prescribed in 2002, a 10 mg tablet oral daily. He also takes Super Advanced Whey Protein from Body Fortress, a liquid protein shake oral daily. He also takes Vitamin C 1000 mg tablet oral daily. He has no known allergies. He denies allergies to latex, denies allergies to pollen, and seasonal allergies. He denies allergies to medication, food, and also denies allergies to animals. For his family history, his mother was diagnosed with depression in 1990. She had a 2-time suicide attempt, the first time in 1990 and the second in 2002. Both suicide attempts were an attempt of an overdose of some kind of medication. The patient does not know what medication his mother tried to overdose on. She is currently living at age 76 years old. His father has no medical history and is still alive at 80 years old. Also, the patient has no siblings. DJ's social history includes the following: no smoking or illicit drug use, primary language English, second is Samoan. He is agnostic, 1 to 2 alcoholic beverages 2 times per month, Currently works as an actor since 2013. Previous occupation was wrestling from 2000 to 2013. Prior occupation to wrestling was college football player from 1996 to 1999. He got married to DG May 3, 1997 and got divorced June 1, 2007. He remarried to LH in 2007. He has two daughters, one born in August 14, 2001 from his first marriage, and one other daughter, born December 16, 2015 from the second marriage. He received all childhood vaccinations. He had his flu shot in 2017, and his last tetanus booster shot, Tdap, was in June 2011. Other and gender-specific healthcare. ARHQ screening completed. Monthly self-testicular examination negative last Friday. High blood pressure screening negative 2017. Diabetic mellitus screening negative in 2017. HIV screening negative 2017. Syphilis screening negative 2017. Hepatitis C screening negative 2017. Hepatitis B screening negative 2017. Physical examination. General, awake, alert, or in the terms for, well kempt. Answers questions appropriately and follows commands. Age appropriate hearing. Seems tired. Skin uniformly light brown in color. Warm, dry, intact, no tinting. Hair evenly distributed, thin texture. No clubbing or discoloration of nails. Beds pink with less than 2-second capillary refill on all four extremities. Head/face. Normocephalic. No lesions, lumps, tenderness. Face symmetrical. No weakness, no tenderness upon palpation of sinuses. No tremor, facial drooping. Perilla. Extraocular muscles intact. Conjunctivae clear, sclera white. No ptosis, nystagmus, leg lag. Discharge. Oropharynx clear, moist. Cranial nerve 5 and 7 intact. External canals clear, tympanic membrane, pearly gray, intact, landmarks intact. No nasal deformities or tenderness. Nares patent. Mucosa moist pink, no drainage. Septum midline, no perforation. Mucosa and gingivae pink, moist. Tonsils +2. Neck. Bilateral equal carotid pulses +2. No bruit. Trachea midline. Thyroid non-palpable. Cervical lymph nodes non-palpable. No tenderness. No JVD. Cranial nerve 11 intact. Full range of motion. Midline symmetric. No masses. No tenderness. Chest. AP diameter 2 to 1. S1, S2 present. No murmurs, gallops. S3 or S4. No edema. Regular heart rate. Even, regular, and unlabored respirations. Resonant lungs. Symmetrical chest wall expansion. Clear and equal lung sounds. No wheezing, crackles, rales, or rhonchi. Spine midline. Nor abnormal pulsations or heaves. No thrills. Abdomen. Soft abdomen without lesions, mass, hernia, redness, moderate distension. No tenderness upon light and deep palpation. Normal active bowel sounds ×4. No broods in aorta, renal, iliac arteries. Femoral pulses equal +2. No enlarged lymph nodes or lymph node tenderness. Genital urinary. No hernia. No tenderness on bladder palpation. No drainage from urethra. No CVA tenderness. Musculoskeletal. Full range of motion with 5 out of 5 strength on all upper and lower extremities. Bilateral. No joint pain, edema, tenderness. No crepitus. No joint arrhythmia. No muscle pain, tenderness, or edema. Gait is even. Neurological. Awake, alert, and orient ×3. Perla. Cranial nerves 1 through 12 intact. Normal sensation. Motor function intact without atrophy. No weakness, no tremors. Behavior, appearance, and speech appropriate. Thoughts coherent. Recent and past memory intact. Psychological. Calm, cooperative, mood stable, and pleasant. Diagnoses. Gastroenteritis is the diagnosis along with dehydration. Gastroenteritis can be tested by stool sample. We can test for the pH, the fecal leukocytes, and a stool culture. We can also do a colonoscopy. E. coli is confirmed by the stool culture. Differential diagnoses possible for this patient is protozoal infection and C. diff colitis. The pharmacological treatment plan for bacterial gastroenteritis and dehydration is to have empiric therapy for the foodborne toxigenic diarrhea. TMP, SMZ 160 mg and 800 mg by mouth every 12 hours or 5 days. Costs about $11 for a supply of 20 tablets. Education includes that the medication is an antibiotic, and to obtain emergency help should an allergy reaction occur, such as hives, difficulty breathing, or swelling of the face, lips, or tongue, or throat. Other side effects may include vomiting, painful or a swollen tongue, being tired, and unable to sleep. Take the medication for the full prescribed length of time, even if infection clears up. Skipping doses may further lead to further risk of infection. Avoid exposure to sunlight or tanning beds and to wear sunscreen when outdoors. An alternative antibiotic is Cipro, 500 mg by mouth, twice a day for 3 days. It costs $8.50 for one tablet. This medication should not be taken with other medications such as Xenoflax for those with a history of myasthenia gravis and those with allergies to Cipro and similar medications. This medication cannot be taken with dairy products like milk, yogurt, or calcified, fortified juice. The patient must be informed to stop taking the medication should they have swelling or tearing of their tendons, especially the Achilles tendon. Antidiarrheals. There are 2 medications that they may take for an antidiarrheal. The first one is loperamide, a 4 mg capsule taken by mouth daily. It's $12.57 for 48 capsules. Side effects include stomach pain, bloating, ongoing or worsening diarrhea, severe skin reaction, constipation, and the patient must be instructed to drink plenty of fluids while taking this medication. An alternative antidiarrheal is diphenyloxate, 2.5 to 5 mg by mouth twice a day or 4 times a day by tablet. It's $303 for a supply of 100 tablets. Side effects include dry mouth, upset stomach, loss of appetite. Serious side effects include mental and mood changes, numbness and tingling of the arms and legs, and severe nausea and/or vomiting. Antiemetics. Pepto-Bismol is an antiemetic that is 17.6 mg per milliliters. Recommendations is to take 30 milliliters by mouth as a liquid form every 30 minutes as needed for a maximum of 8 doses. The cost is about $5.38 for a 352 milliliter bottle. Medications should not be used for children younger than 12. It may cause severe constipation. Overdose requires emergency treatment. It may cause convulsions, hearing loss, confusion, ringing or buzzing in the ears, severe drowsiness or tiredness, severe excitement or nervousness, and fast or deep breathing. Non-pharmacologic treatment plan. Oral hydration, increase fluid intake as tolerated, and monitor intake and output. Recommendation to drink 8 cups of water with 6 to 8 ounces of fluid in the cup daily and to increase fluid intake when in hot environments. He needs to get plenty of rest, and his output should be 0.5 milliliters per kilogram per hour. In his case, urine output should at least be 57.7 milliliters an hour. You need to practice good hygiene, such as hand washing regularly, preventing spread of bacteria and infection, and avoiding sharing steam utensils, towels, clothing, and toothbrush. He needs to wash contaminated objects and items separately. He should not rely on alcohol hand gels for disinfection. Soap and water is the best. He needs to eat small amounts of plain food, such as soup, rice, pasta, and bread as tolerated, and to stay off work for at least 48 hours until his signs and symptoms have passed. Primary prevention. You need to take hygiene precautions by washing hands before eating and after, to eat in reputable restaurants and locations known for their cleanliness, to avoid cross-contamination of foods during preparation, to avoid shellfish and raw food in unregulated environments, and to drink 8 cups, at least of 6 to 8 ounces per cup of fluids daily, and to increase fluid intake in hot environments or when exercising. Secondary prevention: testicular self-examination to screen for testicular cancer every month, colonoscopy once he turns 50, and every 10 years if he's at low risk, diabetic screening every 3 years, cholesterol level screening every 5 years, blood pressure screening every year, an annual dentist examination, an eye examination every 2 years, his flu shot every year, and then Tdap update every 10 years, where the next dose will be due in 2021. Follow-up plan: take antibiotics, antidiarrheal, and antiemetic as prescribed. Follow up in clinic or primary care provider in 10 days to review whether gastroenteritis resolved. Follow up in clinic with referral with infectious disease specialist in 10 days if symptoms do not resolve. Follow up in clinic with referral with gastrointestinal specialist in 10 days if symptoms do not resolve. Return to the clinic or to an emergency department as soon as possible if symptoms worsen, such as uncontrolled vomiting, diarrhea, dehydration, elevated and uncontrolled fever of more than 103 Fahrenheit oral temperature, and if unable to intake fluids or plain foods without vomiting. And that concludes my presentation of celebrity wellness. Here are my references. Thank you.